Well, let's now zero in on the United Kingdom's extra measures and plans for later this year. Joining us, Dr. Peter Moesi is a research fellow with Aberdeen University. He joins us now from Scotland. Thank you for joining us on the programme. What do you make of the government's strategy, how to get through autumn and winter as safely as possible?
Thank you for having me. I think the government's strategy when it comes to the rollout plan and as regards to winter, I think we're well prepared. One, we have aggressive vaccination program. Then two, we have the test and trace and isolate program also involved. Then we have the PCR testing for people who are symptomatic. Then the lateral flow test for people who are asymptomatic. Then also we have the antiviral therapeutics already within the NHS. Then we also have the government support for the NHS, where 5.4 billion was injected into the NHS recently, and 1 billion as well to support the NHS as well. Then also when it comes to the 5-fold plan they have when it comes to addressing COVID-19 during the autumn, we also have the idea where people will be encouraged to use a face mask, hand sanitizers, or wash your hands and keep physical or social distancing. Then a more robust plan to support the international community to ensure that the emergence of new variants are a little bit averted over time.
Is the idea of booster shots to roll out next week in England and Scotland, do you agree with it? And this is also in view of other studies saying scientifically it isn't needed, although one of the scientists at the Prime Minister's briefing said there is clearly a big increase when there is an extra, that's a booster shot in antibodies.
When it comes to the booster shots, I think the science community is a little bit divided on that particular route, and the same goes for WHO and the recent viewpoints that was published in the Lancet journal. Now, the argument is, what is the benefit when it comes to the boosting of this immunity? For instance, people who are immunocompromised, they may likely not have significant level of antibody compared to the first and second dose they had initially. Then also, when you look at the current pandemic across the globe, there are a number of persons yet to receive the first jab. And when it comes to the emergence of new variants, we know that such variants will always emerge from populations that are yet to be vaccinated. Then also, I think for me, when it comes to the booster dose or the third dose, for instance, is that we need to stratify our data, and that stratification is based on the age demography, who are the people more vulnerable, and the age demography as well. But again, when you look at those parameters as well, like I said initially, a first and second dose compared to a third dose for people who are immunocompromised may likely not give a significant effect when it comes to the level of antibody you have also. And don't forget that the immune system is a little bit complicated. And what that means is that you do have other parameters that may likely enable you to fight off the virus. An example of that is your B cells and the neutralizing antibody as well. So it's a little bit, I think, hasty decision going forward when it comes to the booster dose for wealthier nations where you have middle and low income countries yet to receive just one jab.
What would be or should be the trigger for Plan B?
So the trigger for Plan B in the UK is going to be, one, the behavioral pattern of people, also the overwhelming cases in the NHS when it comes to hospitalization and death. So when we have these parameters in place, then the government can say, you know what, we're going to have a mandatory face mask restrictions, a few break in lockdowns here and there. And at the same time, people will be mandated to take jobs, specifically people responsible for care jobs and the NHS staffs as well. But for now, if people behave accordingly, I don't think Plan B may likely kick in.
Finally, Dr. Moesi, I mean, at the end of the day, do you see a transition in the UK from pandemic to endemic?
Yes, I would say yes. I see that clearly because there's a study currently ongoing in Oxford University where we are trying to check the number of people with this antibody in the population based on the natural infection and vaccine-induced immunity. So in the coming days, we're going to tell if we have a significant level of people already exposed naturally and those with the vaccine-induced immunity. And going forward, we do know that in the next couple of weeks or months, people will likely be infected with this virus. But the good news is we do have the remedy when it comes to the vaccine that are still holding up when it comes to severity, hospitalization, and death. And that, again, is reassurance for the general population to say, you know what, despite all of the challenges coming forth, we may likely push this pandemic to an endemic situation in the next couple of weeks or months. But that's it's still based on the behavioral pattern of people and also other developing countries around the world having one jab of this vaccine as well.
All right, we always appreciate your time. Thank you so much, Dr. Peter Moesi is a research fellow with Aberdeen University. Thanks again.
Thank you for having me.